Hi, I'm Dr. Mike Milligan. I'm on the board for the American Academy for Oral Systemic Health, and I'm here with Dr. Gordon Wilson, one of the first 4 dentists licensed for the Lanap periodontal laser, and the largest user, done more periodontal trays than any other dentist in the world. Gordon, thank you so much for being with us.
Thanks for having me. I appreciate it.
Well, now, Gordon, tell us a little bit about the need for periodontal therapy out there. 85% of the people have it.
Yeah, it's been estimated by the World Health Organization that over 80%, almost 85% of adult Americans have some form of gum disease.
Yes.
Okay. The American Academy of Periodontology thinks that that number has actually been underestimated. I know I was looking at some statistics from my office, for example. I understand that the national average for treating periodontal disease is about 4%.
Okay.
And so if 85% of adult Americans have some form of gum disease,
it's not getting treated.
It's not getting treated.
And it needs to be treated. It's related
to
heart.
It's been linked to heart disease, it's
right.
been linked to diabetes, it's been linked to stroke, and those right there, that's 3 of the top 5 or 6, depending upon whatever the year is, preventable causes of death.
Okay.
Okay, in the United States.
And the bacteria goes from your gums through the bloodstream, causes inflammation, and,
exactly.
and causes these problems. So it's something that needs to be dealt with.
It's not a minor infection. It's serious.
In fact, the cardiac surgeons will tell you that the majority of the heart valves that they replace and see a concern with is due to a dental infection.
Yes.
So tell us a little bit about non-surgical periodontal therapy.
Well,
and how you've come to develop that and patent that protocol.
Okay. Well, basically, your patients don't want to have their gums cut open because the more invasive the procedure is, the more swelling there is. The more swelling there is, the more pain there is.
Right.
Okay. So the patient isn't likely to be as compliant.
Right.
So what we're trying to do is we're trying to find the least invasive, most cost-effective manner for treating periodontal disease so that the patients are compliant.
It sounds like something people would want to do.
And that's what we have with our patent pending protocol. Approximately 85% of my cases are non-surgical.
So you'd say of the people with periodontal disease, and there are a lot of them out there, 85% would be able to be treated by your methods?
By my methods, non-surgically. Now, the other 15% that needs surgical pocket reduction, we don't want to use the scalpel and stitches. We want to use a laser instead of that because, again, a laser is less invasive. Because it's less invasive, there's less swelling. Because there's less swelling, there's little to no pain, and there's faster healing times.
Okay. Well, wonderful. Does this really work? I mean, tell us, does it really work?
Absolutely.
Okay. You've done
thousands of cases. Thousands of cases.
There have been tens or even hundreds of thousands of cases done worldwide with the methods.
I actually have a lot of documentation on my website of bone regeneration. You know, we were taught in dental school, once bone is lost, it never grows back.
Right.
We actually can get the bone to grow back in many cases and save teeth that otherwise would have been extracted.
Well, how does this work? What do you do? What is the procedure?
Okay. Well, we want to get everybody started on Perio trays. Okay, Perio Protect trays. Okay. What the Perio trays do is they actually they place medication at the site of the infection to help get the disease under control. There is no cure for periodontal disease, but you can control it.
Right.
And as far as I've been treating periodontal disease now for nearly 20 years, I have never seen anything as effective as these Perio trays at helping the patient control the periodontal disease.
Right. So tell us some of the results that you're seeing.
We're seeing pockets go away. We're seeing bleeding go away. Now, what we're shooting for, we're not looking for perfection because there's nobody who's perfect.
Right.
Okay. Right. So if I can get somebody to have maybe anywhere from 5 to 10 bleeding points and 5 to 10 shallow pockets throughout the mouth, then that's a huge success, especially if we started with somebody who's got 100 bleeding points and 100 pockets. I mean, that's a 90% improvement right there.
Absolutely.
You know, so
much healthier mouth,
absolutely,
much less chance of that causing heart disease, stroke.
And our real goal is right around about 5 or 6 bleeding points and 5 or 6 shallow pockets per mouth per patient.
So that's a wonderful result, and you're certainly helping a lot of patients with that treatment, and we're helping a lot of people through that.
Okay.
Dr. Wilson, thank you so much for being with us.
Thanks again. I appreciate it.